Have you ever thought about how lucky you are to be born in the age of modern antibiotics and advanced surgery? When you feel sick today, you take a pill, maybe see a doctor, and expect to get better. But if you were living in the medieval period, the solution to your ailment might have been far more terrifying than the sickness itself. To understand medieval medicine, we have to throw out everything we know about germ theory. They lived in a world dictated by the theory of the four humors: blood, yellow bile, black bile, and phlegm. Health was defined as a perfect balance of these four fluids. When you got sick, it was believed that your humors were out of balance. The doctor's job wasn't to fight a virus, it was to rebalance your internal ecosystem. The most infamous method for this was bloodletting. If you had a fever, a headache, or even just general malaise, the solution was often to drain a significant amount of your blood. They believed that getting rid of excess or bad blood would stop the infection. It didn't matter if the patient was already weak. The logic demanded the removal of the fluid. It is sobering to think how many people died not from their initial illness, but from the extreme anemia induced by their own physicians. Then there is trepanation. This sounds like something out of a horror movie, but it was a documented practice. Surgeons would use a specialized drill to create a hole in the patient's skull. The intent was usually to relieve pressure, or, more metaphysically, to let out malevolent spirits or bad humors that were believed to be causing mental illness, seizures, or severe migraines. While archaeological evidence suggests that some patients actually survived this procedure, the lack of sterile environments makes it a miracle that anyone pulled through at all. Beyond these procedures, the medieval apothecary was filled with substances that would make a modern pharmacist faint. Remedies often involved crushed animal parts, strange herbs, or substances believed to have mystical properties. If you had an infection, you might be treated with a poultice made of moldy bread or raw meat. Without a concept of bacteria, these remedies were often just creating new sites of infection. It is easy to look back with judgment, but that would be unfair. Medieval doctors were working with the best frameworks they had. They were genuinely trying to heal, often within a system that placed just as much importance on prayer and religious penance as it did on physical treatments. The mortality rate for medieval medicine was, predictably, astronomical. Often, the doctor's intervention was the final blow that led to death. Yet, this era represents a critical, albeit brutal, step in the development of human knowledge. It shows us exactly what happens when the desire to heal lacks the foundational data of the scientific method. Please subscribe to this channel for more looks into the history of humanity.